April is Alcohol Awareness Month, and it's a good time to talk about just how much alcohol you're drinking and how it can affect your heart. Despite what some have believed and hoped, health experts are now finding there's actually really no evidence that shows drinking alcohol can be beneficial to our heart health. Sorry to break that news to you folks. So here to talk more about this, we're joined by Oakland Medical Center Physician-in-Chief, Dr. Rita Ng from Kaiser. Thank you so much for joining us.
Good morning.
So that's not going to be good news. So we kind of believe like, oh, you know, I have one glass of wine a day. It's kind of good for me. It's not good for us?
I know. I'm sorry to break the bad news. As a cardiologist, I used to routinely tell people, have a glass of wine a night. It's good for your heart.
So that wasn't just us. Like,
No.
I mean, we all kind of believed, hey, this is moderation. You can have one glass and it's totally fine.
You're right. The literature was very confusing over the past decades. What we're finding is that as we are getting more refined in our scientific studies, that is not so much true. Last year in the JAMA network, there was a new study that came out that was a bit groundbreaking. It was a study of about 400,000 folks in the UK, which looked at the use of low to moderate amounts of alcohol, and it demonstrated actually that even a small amount of alcohol can have a deleterious effect on your heart.
Okay, so let's talk about what actually happens to our hearts.
Yeah, so there's a couple of different effects from alcohol. Number one, it actually damages DNA. So when you consume alcohol, it breaks it down into toxic metabolites, something called acetaldehyde. That actually directly damages your cells and inhibits it from repairing itself. So you can lead to things like cancer. So we know that alcohol leads to higher rates of head and neck cancers, colorectal cancer, breast cancer, liver cancer, and other things that are dangerous.
These are very serious.
Very
serious things.
Yes. It also leads to something called oxidative stress, which can lead to stiffening and hardening of blood vessels, leading to high blood pressure. We also know that it's a diffuse cerebellar toxin and neurotoxin, which can impact cognition and those types of things.
You know, and when you're talking about all of these things, you know, whether it's our blood pressure or you know, some of the very more complex medical issues that you're talking about, some of those things we don't feel those, right? I mean, this is, I'm sure as a cardiologist, this is what you're drinking, you're like, I feel fine, I'm exercising, and you don't realize what's kind of happening internally that could impact you later when you're saying to yourself, how in the world did I get here?
Yes, you summarized that perfectly. So how much is too much? And first of all, really knowing your body. The studies show that actually an excessive amount of alcohol is quantified as anything more than a glass of wine for a woman, 2 glasses for a man. Doesn't seem like very much. And
it doesn't, right? I mean, that's not, I mean, a lot of people can do that, you know, very easily even before dinner gets there on their table, right?
And the kicker is it's not on average. So you could be dry all week and then drink 5 to 7 glasses on the weekend. Doesn't work that way. So it is 1 or 2 per day. And, you know, really the key is moderation, right?
So even with this, even knowing, you know, that you're not really supposed to drink, I guess, any. If you wanted the A+, you know, report card, just don't drink, I guess, is the rule. But that's not really realistic.
No,
I mean,
it's not
I think isn't medicine also saying, okay, here's my patient who loves wine. Maybe they're a winemaker. Maybe they work in Napa. Maybe they just, you know, enjoy it. How do we do that without feeling like, you know, we're being irresponsible or unhealthy?
That's exactly the message. So moderation is the key. We all know that prohibition did not work. So just telling people not to drink, that's not going to work. And the key is really to drink responsibly and know your body. So for example, if you already know that you have a high risk of liver cancer or disease in your family and your genetics, probably best to try to limit as much as you can your alcohol. No more than 1 or 2 glasses of wine, depending on if you're a male or female, and depending on how you're feeling with it. Secondly, if you're drinking more than that amount, try to cut down. So if you are in the more of the 5 to 6 range, you want to cut it down as much as you can to more reasonable amounts. And then do those things that are positive in your life. Go outside, eat healthy fruits and vegetables, exercise, have a good social network. So it's possible to do it, but do it responsibly.
So my takeaways are, you can't average it out. So don't have a big Saturday night and be like, oh, that was fine over 7 because I didn't drink.
Yes.
And also, I guess if you're one of those people who thought, oh, a glass of wine a night helps me, but you don't really need that glass of wine, or you don't really want that glass of wine. It actually isn't helping you, so maybe save your vices for something else a little later, and don't just drink it to drink it.
Okay, I'm going to quantify you as an A+ student.
Oh.
That was exactly, I couldn't have summarized it better. That was exactly
okay.
the right message.
Well, those are good.
Moderation and know your body.
Good advice. As we become more aware, that's the most important. All right,
Yes.
Dr. Rita Ng, always great to have you in.
Wonderful
Always
to
great
see you.
advice, and advice that we can use, Rosemary. It's not nothing. we can't just say let's have nothing, but we should
Yes.
think about what we have.
Yes, thank you.